Hey there, it's Dr. Jim. My topic today is neurodegenerative disorders and quality of life. If you are a professional or an informal caregiver, I'm speaking directly to you because you probably are treating, have treated, or will care for someone with one of these disorders. So, as our population and life expectancy both increase in the United States at the same time, they are, the risk of developing a neurodegenerative disorder unfortunately also increases. From the moment of diagnosis to the very final stages of one of these diseases, that person is going to experience changes that will ultimately lead to a decrease in quality of life associated with that disorder. It's therefore a major goal of any caregiver to monitor very closely various aspects of quality of life and then intervene in ways that improve or stabilize the individual's symptoms and their quality of living. There are many neurodegenerative disorders to talk about, but let me name a few: frontotemporal dementia, amyotrophic lateral sclerosis, or ALS, Huntington's disease, brain trauma, Parkinson's disease, Pick's disease, prion disease, and Huntington's disease. Although each disorder is characterized by very specific symptoms and clinical presentations, there's one thing they all have in common, and that is progressive neuronal cell death. So, neurodegenerative disorders are the product of gradual degeneration and or cell death of neurons, which are cells responsible for functions of the nervous system. The degenerative process affects a number of functions, including body movement and brain function. Body movement, as in particular, Parkinson's disease. Many will cause dementia, leading to a decline in cognitive functions that negatively impact memory, thinking, behavior, emotions, learning, communication, calculation, and language skills. So, regardless of the disorder, the progressive deterioration over the course of years chips away at the quality of life of both individuals, but their families as well. And because people are living longer, neurodegenerative disorders can linger longer than they did just a few short decades ago. So let me define quality of life. This is a concept that many experts and researchers have had a difficult time conceptualizing and quantifying. It attempts to capture some very important factors, including basic necessities of life, feelings of satisfaction with your life, health, and general well-being. It represents a wide range of lived experiences while including physical, social, psychological, emotional, cognitive, and spiritual dimensions. It's a very complicated concept. Quality of life also encompasses an individual's sense of autonomy, sense of control, and independence. It relies on the social environment, the physical environment, a level of support from others around that individual, as well as quality of interpersonal relationships. Again, it is a complicated concept. With this being said, though, quality of life is almost always the goal in the treatment of someone with a neurodegenerative disorder as well as some other type of incurable disease. That's an important takeaway. Quality of life is almost always the goal, the main goal in treating someone with a neurodegenerative disorder. And it has to be the goal because there are no pharmaceutical cures for any of these disorders. And the causes We still largely don't know where they're coming from, what's starting these diseases or disorders, the root causes. Healthcare professionals and others, caregivers out there, will rely on medications for symptom management, psychosocial support, and lifestyle factors to help that person cope with the disorder and live their best life possible. So, there's a big question here. How do neurodegenerative disorders decrease or chip away at quality of life? And I'm going to give you some major points here. I've got four of them. One way to approach understanding how these disorders can diminish a person's quality of life is to identify symptoms and clinical manifestations which are associated with them. And in doing so, it helps to place symptoms impacting quality of life into various domains that we could work on, including physical, mental, emotional, and social. Let's take a look at each one of these. Physical symptoms. Neurodegenerative disorders can be very painful, as in the case with multiple sclerosis and Parkinson's disease. Pain alone can lead to a decrease in movement and mobility, activities of daily living, and being socially active. These, in turn, can create a negative self-esteem and self-image. Pain is also highly associated with a greater sense of fatigue and poor sleep. Other physical changes leading to decreased quality of life include motor impairment, weakness, sexual dysfunctions, and urinary and bowel complications, which are associated with most of these disorders. Now let's look at mental. Those were physical. Let's look at mental symptoms. These disorders can lead to dementia, cognitive decline, forgetfulness, and impaired memory, and an inability to calculate or plan ahead, as seen most commonly in individuals with Alzheimer's disease. People may experience confusion, hallucinations, delusions. They may also develop sleep disturbances, nightmare disorder, or REM sleep behavior disorder, as in the case with Parkinson's disease. All right, let's move on now to emotional problems. Quality of life may diminish greatly due to the emotional problems associated with any of these neurodegenerative disorders. The initial shock, think about it, when being first diagnosed, can lead to stress, anxiety, and depression. And as these disorders progress, these symptoms can become worse and take a greater toll on that person's quality of living. There's also a risk for thinking about suicide or attempting or completing a suicide. An individual can really, really suffer greatly. We've seen it over and over again. And some people may want a way out of the pain, the suffering, or the guilt that they feel from their families watching them suffer. Number 4, social issues associated with neurodegenerative disorders. The individual may develop socially inappropriate behaviors, like a lack of empathy, inappropriate affect, uncontrollable laughing or crying, or disinhibition. These behaviors and others can make the individual and other people feel very uncomfortable and cause relationship problems, as well as reduce social outings and activity. In other words, there's a word for this: stigma. The stigma of neurodegenerative disorders can unfortunately decrease quality of life. So, how do we improve? This is the big takeaway, and thanks for hanging in there with me because I'm still going strong here. Yeah, I've got more information for you. Don't give up on me. You might want to pause and go grab a cup of coffee or a glass of wine. I'm not judging anybody. Here are some ways to improve quality of life. We know it's clear that neurodegenerative disorders negatively impact a person's quality of life in a number of ways. These disorders can also cause great stress and burden on family members, friends, and caregivers. Despite the fact that the cause of these disorders is still unknown and there is no medical cure available, there are thankfully a number of things that can be done to maintain or improve a person's quality of life. Number one, start with a person-centered approach, always. Since the goal is to improve or maintain a good quality of life, it's important to focus on the individual and take a fully person-centered approach. Why? Everybody's different. Everyone's coping style and mechanisms and everything else about them is different. Symptoms will be different. How they react to symptoms will be different. Individuals will respond to various treatments and interventions in their own unique way. In other words, there's no one-size-fits-all approach in helping individuals live their best life with neurodegenerative conditions. Number two, symptom management is important because we have to help what's hurting. Since there's no cure, the management of symptoms may improve or maintain quality of life. This can be achieved through the use of prescription medications for pain, spasticity, depression, and lots of other symptoms. Psychosocial therapy can be effective in reducing behaviors, stress, anxiety, and other behaviors. Physical, occupational, speech therapy, they can all be effective in areas like maintaining strength, improving mobility, or dealing with any type of speech difficulty the individual might have. When cognitive symptoms develop, various forms of therapy, like cognitive stimulation, can be very effective in helping that individual maintain independence a little longer, or perhaps slow down the decline a bit. Cognitive stimulation can improve memory, attention, and general cognitive functions, especially among individuals diagnosed with Alzheimer's disease. Number three, integrative medicine. This is uniquely positioned to treat neurodegenerative disorders. If you haven't looked into integrative medicine and neurodegenerative disorders, please do so, but I'm going to give you a little taste of it. The aim of integrative medicine is to treat the whole person, physically, emotionally, mentally, cognitively, spiritually, and more. It doesn't only treat acute symptoms of these disorders as they appear, but considers all related symptoms that are associated with these disorders, like pain, for instance, or depression, with the aim or the goal of improving quality of life. Some experts actually believe that integrative medicine may slow the disease progression. It would be miraculous if it did. And number four, focus on activities of daily living, ADLs. One area that is greatly impacted by neurodegenerative disorders and deteriorates even more as these diseases progress are the activities of daily living, or ADLs. These are basic activities that are done every single day. They're done routinely. You and I do them without even thinking about them. Showering, grooming, dressing, toileting, eating, walking. We all do these. The individual will eventually become dependent in these areas, but working on them regularly, daily, can help with independence and confidence. Eventually, independent activities of daily living will become affected as well, like paying bills, scheduling appointments, going out and shopping. And number 5. I thought I had 4, I have 5. Stress management. Symptoms and clinical manifestations associated with these disorders can cause great stress, anxiety, and panic. Helping the individual become more aware of the triggers, helping them to manage stress and cope with changes as they take place, can improve quality of life. Breathing techniques, mindfulness, prayer, meditation, and other alternative methods can also improve quality of life. Now, here are my final thoughts. Thank you for hanging out there with me. I appreciate it. The aging population is steadily growing in the United States, and people are living longer with chronic and debilitating illnesses, including neurodegenerative disorders. Most experts agree that the number of people with these disorders is only expected to climb for decades to come, and with them, a decline in quality of life. Perhaps the future will bring a better understanding. Hopefully the future will bring us a cure. But until then, doing whatever it takes to ensure that individuals live their best lives is our aim and our goal. Thank you so much for hanging out with me. I know that this was a long one, but I wanted to create something deeper and more meaty, if you will. So thank you. There's an article. You've watched the video. Please share this with your colleagues, your friends, your family. Neurodegenerative disorders and quality of life. I'm Dr. Jim. Keep coming back for more information. I'd love to see you. Take care. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.